Protecting your sight. Preventing diabetic retinopathy through blood sugar. Control and regular eye exams. Welcome back to Health Sphere. Diabetes is a chronic condition that affects millions worldwide, and while managing blood sugar is key to overall health, it's also crucial for protecting your vision. One of the most serious complications of diabetes is diabetic retinopathy, a condition that damages the blood vessels in the retina, the light-sensitive tissue at the back of the eye. If left unmanaged, diabetic retinopathy can lead to severe vision loss and even blindness. The good news is that diabetic retinopathy is often preventable, or its progression significantly slowed with proactive management, primarily through diligent blood sugar control and regular, comprehensive eye exams. Understanding diabetic retinopathy. How high blood sugar harms the retina. The retina is a thin layer of tissue lining the back of the eye. It contains millions of light-sensitive cells that convert light into electrical signals. These signals are then sent to the brain via the optic nerve, where they are interpreted as the images we see. The retina has a rich network of tiny blood vessels that supply it with oxygen and nutrients, essential for its proper function. In individuals with diabetes, consistently high levels of glucose in the blood can damage these delicate blood vessels in the retina over time. This damage occurs through several mechanisms: weakening of blood vessel walls. High blood sugar can weaken the walls of the small blood vessels, causing tiny bulges or pouches to form called microaneurysms. Leakage of fluid and blood. Damaged blood vessels can leak fluid, blood, and fats into the retina. This leakage can cause swelling of the retina, particularly in the macula. This swelling is called macular edema and is a common cause of vision loss in diabetic retinopathy. Blockage of blood vessels. High blood sugar can also cause the blood vessels to narrow or become blocked, reducing blood flow to areas of the retina. This lack of oxygen and nutrients is called ischemia. Growth of abnormal new blood vessels. In response to reduced blood flow and oxygen deprivation, the retina may try to compensate by growing new blood vessels. However, these new vessels are often abnormal, fragile, and can easily bleed into the vitreous humor. Bleeding into the vitreous can cause floaters, or in severe cases, block vision entirely. These new vessels can also form scar tissue, which can pull on the retina and lead to retinal detachment, a serious condition that can cause significant and permanent vision loss. Diabetic retinopathy typically affects both eyes and progresses through stages, from mild non-proliferative diabetic retinopathy, characterized by microaneurysms and minor leakage, to proliferative diabetic retinopathy, more advanced stage involving the growth of abnormal new blood vessels. The power of control, preventing or slowing progression. The most impactful strategy for preventing the onset and slowing the progression of diabetic retinopathy is maintaining strict control of blood sugar levels. Numerous studies have demonstrated that keeping blood glucose levels within the target range significantly reduces the risk of developing diabetic retinopathy and minimizes its severity in those who already have it. Here's how tight blood sugar control helps protect your retina. Reducing damage to blood vessel walls, keeping blood sugar levels stable, minimizes the harmful effects of excess glucose on the walls of retinal blood vessels. Reducing the formation of microaneurysms and leakage, improving blood flow. Better glucose control helps maintain healthier blood vessel function, ensuring adequate blood flow to the retina and reducing the risk of ischemia. Slowing the progression of existing damage. For individuals who already have some degree of diabetic retinopathy, consistent blood sugar control can slow down the worsening of the condition, reducing the likelihood of progressing to the more severe proliferative stage. Decreasing the need for more invasive treatments by preventing or slowing the progression of retinopathy. Good blood sugar control can lessen the need for treatments like laser surgery or injections into the eye, which are used to manage more advanced stages of the disease. Achieving and maintaining good blood sugar control involves a multifaceted approach, including healthy eating, following a balanced diet low in refined sugars and carbohydrates. Regular exercise, physical activity helps lower blood sugar levels and improves overall cardiovascular health. Medication adherence, taking diabetes medications, including insulin if prescribed, exactly as directed by your healthcare provider. Regular blood sugar monitoring, checking your blood glucose levels regularly to stay informed and make necessary adjustments to diet, exercise, or medication. HbA1c monitoring. This blood test provides an average of your blood sugar levels over the past 2 to 3 months and is a key indicator of long-term glucose control. Working with your doctor to achieve and maintain your target HbA1c level is crucial for preventing diabetic complications. Beyond blood sugar control, managing blood pressure and cholesterol levels is also vital for protecting retinal health. As high blood pressure and cholesterol can further damage blood vessels, not smoking is also extremely important, as smoking significantly increases the risk of diabetic retinopathy and other diabetes-related complications. Seeing clearly, the importance of regular eye exams. Even with excellent blood sugar control, individuals with diabetes are still at risk for developing diabetic retinopathy. Furthermore, early stages of the condition often have no noticeable symptoms. By the time vision changes occur, the retinopathy may be more advanced and harder to treat effectively. This is why regular, comprehensive, dilated eye exams by an ophthalmologist or optometrist are absolutely essential for everyone with diabetes. Regular eye exams allow eye care professionals to detect diabetic retinopathy early. Eye doctors can often identify the early signs of diabetic retinopathy, such as microaneurysms or small hemorrhages, before they cause any vision changes. Monitor the progression of the disease. Regular exams allow the eye doctor to track any changes in the retinal blood vessels over time and determine if the retinopathy is worsening. Initiate timely treatment. If diabetic retinopathy is detected or is progressing, the eye doctor can recommend and initiate appropriate treatment to prevent or minimize vision loss. Early treatment is much more effective in preserving vision than waiting until significant damage has occurred. Detect other diabetes-related eye conditions. Diabetes also increases the risk of other eye problems, including cataracts and glaucoma. A comprehensive eye exam can screen for these conditions as well. Recommended eye exam frequency. The recommended frequency of eye exams for individuals with diabetes depends on several factors, including the type of diabetes, how long you've had diabetes, your age, and whether you already have signs of diabetic retinopathy. The American Diabetes Association and other professional organizations provide guidelines for eye exam frequency. Type 1 diabetes. Individuals with type 1 diabetes should have their first comprehensive dilated eye exam within 5 years of diagnosis. After puberty has begun, following the initial exam, annual dilated eye exams are typically recommended. Type 2 diabetes. Individuals with type 2 diabetes should have a comprehensive dilated eye exam at the time of diagnosis. This is because many people with type 2 diabetes may have had the condition for some time before being diagnosed, and some may already have signs of diabetic retinopathy at diagnosis. Following the initial exam, annual dilated eye exams are typically recommended. More frequent eye exams may be recommended by your eye care professional if you have signs of diabetic retinopathy. The severity of the retinopathy will determine how often follow-up exams are needed. Your blood sugar control has been poor. You have high blood pressure or high cholesterol. Your pregnant women with diabetes are at increased risk of developing or worsening diabetic retinopathy and often require more frequent monitoring throughout pregnancy and for a period after delivery. It is crucial to follow your eye care professional's recommendations for the frequency of your eye exams, as they will tailor the schedule based on your individual risk factors and the health of your eyes. Taking action to protect your vision. Living with diabetes requires a commitment to managing your health, and protecting your vision is a critical part of that commitment. By understanding the link between high blood sugar and retinal damage, prioritizing strict blood sugar control, and adhering to the recommended schedule for comprehensive dilated eye exams, you can significantly reduce your risk of vision loss from diabetic retinopathy. Don't wait for symptoms to appear. By then, irreversible damage may have occurred. Make your eye health a priority and work closely with your diabetes care team and eye care professional to keep your vision clear for years to come. Thank you for joining us on HealthSphere. Stay healthy, stay informed, and protect your precious gift of sight. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor or eye care professional for diagnosis, treatment, and personalized recommendations regarding your health situation.